Welcome to Unit 6, Medical Law and Ethics. In this section of the unit, we will cover quality assurance, utilization review, and risk management in the healthcare field. Behavioral objectives for quality assurance. You should be able to compare and contrast risk management and quality management. You should be able to describe the 4 principal steps in the risk management process. You should also be able to list the activities that are part of the quality management process in an organization. As well, you should identify laws that a healthcare organization should consider when creating a corporate compliance program. Definitions. Risk management. Risk management and quality management are intertwined. Providing quality management reduces risk. Avoiding events that are calculated risks helps to provide quality management. Risk management is the identification of and prioritizing of risks that may adversely affect the organization. Quality management. Those managerial activities that are directed at the control of quality, improvement of quality, and quality assurance. Compliance programs. Compliance programs are those programs instituted by an organization to implement the quality initiatives. Increased scrutiny of medical errors and demand for improving quality care. In 1999, the Institute of Medicine, IOM, released a landmark report on medical errors. It was called "To Err is Human: Building a Safer Health System." The report found that more people have died from preventable medical errors than from some of the leading causes of mortality. The report noted that the errors were system failures, not people failures. The report also emphasized that voluntary and mandatory reporting programs were needed immediately. The report triggered QI, or quality initiatives, to assure the public that the errors were being attended to. Patient safety in the medical environment was the primary drive. Research into means to achieve this goal is headed by the Agency for Healthcare Research and Quality, or AHRQ. AHRQ established the Center for Quality Improvement in Patient Safety, CQULPS, to provide guidelines and standards for patient safety. CQULPS conducts research into patient safety and healthcare quality measurement, reporting and improvement, and disseminates these results to its members. Quality organizations. Some of the organizations that are involved in quality measures are the following: the Institute of Medicine, the Agency for Healthcare Research and Quality, or AHRQ, the Joint Commission, TJC. This is a new name. That used to be the Joint Commission on Accreditation for Hospitals Organizations. They've abbreviated themselves now to TJC. The Centers for Medicare and Medicaid Services, or CMS. The Centers for Disease Control and Prevention, or CDC. The Institute for Healthcare Improvement, and the National Patient Safety Foundation. Relationship between risk management and quality management. Risk management and quality management employ similar methodologies in their attempts to ensure patient safety. Both quality and risk management establish screening criteria to help establish goals and priorities. As well, they both collect data related to the criteria. The end goal of both is to correct the identified problem areas. This is done by focusing on the individual practices of the organization with emphasis on the system-wide delivery of care. Relationship between risk management and quality management. Quality management activities approach the problem areas with what should occur and what goals should be focused on and implemented. Risk management, on the other hand, looks at what has occurred that should not have occurred. The focus is therefore on risk identification. Risk management. There are 4 components to the implementation of risk management in an organization. Number 1, risk identification, which identifies events and activities that expose the organization to risk. This activity is retrospective or looks at what already has happened through incident reports, length of stay data, unexpected patient returns, and accreditation reports. Number 2, risk evaluation. The evaluation consists of an analysis of loss frequency and loss severity indices. Number 3, risk handling. This involves the agency's response to risk, or how will the potential risk be avoided or handled if it occurs. Number 4, risk monitoring. This is the ongoing evaluation of risk in the agency and procedures have been taken to correct. HIM involvement in risk management. Health Information Management, or HIM, employees are involved in risk management activities in the following ways. They supervise data gathering, the training of clerical personnel in policies and procedures related to risk management, determination of the incidence of relevant data, screening of medical records, participation in the selection of and design of forms used in the medical record, performance of surveillance of the practice indicators, insurance of the privacy of the records, and reviewing requests for access to records. Quality management. QI, or quality initiatives, is another name for QM, or quality management. QM focuses on organizational issues and functions. In particular, it focuses on the following: the governance of the organization, the management of the organization, the support functions of the organization, the direct patient care delivered through the organization. QM is implemented through educational initiatives throughout all levels of the organization. QM also performs evaluations of statistical data collected during reviews and audits of the organization. Outcome research. Does the process of the organization produce the desired outcomes? Comparative research. Does one procedure produce better results than another procedure? Measurements of illness severity, which predicts resource utilization by the organization. Patient satisfaction surveys. Is the organization performing up to the expectations of the patients who use the organization? Benchmarking, which is an evaluation by comparison with a given standard. Quality management. The Joint Commission, TJC, is a voluntary organization that requires quality management as part of its accreditation process. TJC standards require quality management programs to have the following in place: a plan, a design for quality management, measurement, assessment, and improvement. National Committee for Quality Assurance. The National Committee for Quality Assurance, NCQA, accredits managed care organizations, or MCOs. It requires MCOs to have a comprehensive quality management program in place. NCQA focuses on the tracking of issues uncovered in the quality management process during their evaluation. HIPAA. Covered entities are permitted the release of PHI or protected health information for quality initiatives and quality management programs. Compliance programs. Compliance programs are system-wide procedures designed to reduce liability and prevent fraud and abuse. The programs are designed by the organization to fit their model of care. Effective compliance programs. Effective compliance programs have the following elements: standards and procedures that reduce the prospect of wrongdoing, a high-level overseer who must be assigned to oversee all compliance programs. A responsible individual should not be prone to engage in illegal activities. Communication of standards and procedures must be done to all employees. And development of a monitoring and auditing system to ensure compliance, as well as development of enforcement and disciplinary procedures. Compliance programs. The Department of Health and Human Services, or DHHS, Office of the Inspector General, OIG, requires the following components in a compliance program for hospitals. The compliance program must have a written standards of conduct. Must also identify risk areas. There should be reinforcement of statutes and regulations related to claims. as well as guidelines for compliance with medical necessity standards, anti-kickback regulations, and anti-referral statutes. Procedures for coding, admissions, and discharges should also be included, as well as bad debt reporting. Management, quality review, and compliance activities, and pay-per-performance activities. TJC, or the Joint Commission, recognizes the following criteria for a medical record, which is the key source of data on the patient and for research. The record should facilitate patient care. It should also serve as a financial and legal record. It should aid in clinical research. It should support decision analysis. And it is also used in performance improvement and evaluation of outcome of care.